Hello, my name is Lisa Seidl, and my drug of choice for case study 2 is methimazole. So, my patient is an 18-year-old female, and the primary concern for her visit was that she was recently diagnosed with Hashimoto's hyperthyroidism as well as Graves' disease. And this was after she presented with consistently high blood pressure, tachycardia, and some memory fog. And she was not currently doing any other treatments to work against this hyperthyroidism, and she wasn't taking any other medication or had any relevant medical history, except that she had a significant family history of thyroid issues going a few generations back in her family. So the solution that our doctor decided on was to prescribe methimazole, also known as Tapazole, at a 10 milligram dose initially, once daily. This is after the initial diagnosis. And so the reason for this drug choice was that it is a first-line drug for treating hyperthyroidism and Graves' disease, so it's effective for both. And it has a longer half-life than its counterparts like PTU, and because of that, it only requires one dose a day, so it's easier for the patient to manage. It's also less invasive than other options such as radioactive iodine therapy or a thyroidectomy. And like I said, the patient was given initially a 10 milligram dose once daily. And after 6 months, this was lowered to a 5 milligram maintenance dose. And then again to 2.5 milligrams after about 8 months again. And then 6 months after that, the medication was no longer taken because her thyroid hormone levels were stabilized and she was no longer considered to be in a hyperthyroid state. So in that sense, the medication was successful. And in general, this medication has pretty limited adverse effects, the most common one being skin rashes, and then the most dangerous ones being hepatotoxicity or agranulocytosis. But luckily, this patient didn't experience any of those symptoms, so she was allowed to continue with her medication regimen until it was no longer necessary.